Von Willebrand disease is a bleeding disorder caused by a deficiency in the quantity or the quality of von Willebrand factor, a plasma glycoprotein that plays a key role in forming blood clots needed to stop bleeding. The disease was named after Erich Adolf von Willebrand, a Finnish physician who first described it in 1924. Von Willebrand factor is synthesized and stored in the endothelial cells and megakaryocytes. Its synthesis is regulated by the von Willebrand factor gene located on the short arm of chromosome 12. Alright, when there is a bleeding injury to a blood vessel, histamine and thrombin stimulate the local endothelial cells and megakaryocytes to release the von Willebrand factor into the bloodstream. After its release, it attaches to the exposed collagen fibers located in the wall of an injured blood vessel, where it serves as a glue-like substance that sticks to platelets receptors known as glycoprotein 1b, or simply GP1b. Within the bloodstream, more of von Willebrand factor starts to bind more platelets together into a kind of a mass, over which fibrin fibers deposit, forming a clot needed to plug the injured vessel and thus stop bleeding. In addition to binding platelets together, von Willebrand factor also binds and carries factor VIII. Factor VIII plays a major role in the blood clot formation process, and to work well, it is supposed to be bound to the von Willebrand factor because, in this case, it is protected from early degradation by protein C and S, which would remove it from the circulation before it does its job. Now, in von Willebrand disease, there isn't enough working von Willebrand factor to help with platelet adhesion and to bind and carry factor VIII, both of which makes it really hard to stop bleeding. The majority of von Willebrand disease cases are inherited, but it can also be acquired. In the inherited form, there is a mutation in the von Willebrand gene, and the gene gets passed from parents to children. Inherited von Willebrand disease is classified into three main types: type 1, 2, and 3. Von Willebrand disease type 1 is the most common, making up 75% of all cases. It is autosomal dominant, meaning that a mutation in only one allele results in insufficient or even defective production of von Willebrand factor. In von Willebrand disease type 2, the quantity of von Willebrand factor might be enough, but the problem becomes the quality. The type 2 is divided into 4 subtypes on its turn, which are type 2A, type 2B, type 2M, and type 2N. In both type 2A and type 2M, von Willebrand factor attaches well to the subendothelial collagen and factor VIII, but it is unable to properly bind the platelet together to form a plug needed to stopper a hole in a bleeding vessel. So in this case, it's like a fake glue that can't hold things up. In type 2B, von Willebrand factor binds platelets in the bloodstream. It is like the glue is too sticky, binding platelets everywhere, even when there is no injury. This causes large bundles of platelets to form in the bloodstream, which are taken out by the spleen and the liver, resulting in a low platelet count, another risk for bleeding. In type 2N, it binds both the subendothelial collagen and platelets well, but it poorly binds to factor VIII. So the factor VIII starts being degraded quickly, thus causing its levels in the bloodstream to fall, which also increases the risk for bleeding. The rarest, but also the most severe type of von Willebrand disease is type 3. It is an autosomal recessive disorder, meaning that both alleles must be defective to have symptoms. Because both alleles are affected, people with type 3 von Willebrand disease present with virtually no von Willebrand factor in their bloodstream, making the disease very severe. Also, since von Willebrand factor binds and transports factor VIII, people with von Willebrand disease type 3 typically present with a very severe factor VIII deficiency. Sometimes von Willebrand disease can be acquired, meaning having normal von Willebrand factor genes, but yet present with the symptoms. This can be due to several physiologic disturbances that happen in other diseases, such as some autoimmune disorders like systemic lupus erythematosus, where the body produces antibodies against self-antigens, including von Willebrand factor, destroying it, and causes its levels in the bloodstream to drop. Other causes of acquired von Willebrand disease include some medications such as valproic acid and ciprofloxacin. These medications have been found to interfere with the synthesis of von Willebrand factor. All right, now people with von Willebrand disease present symptoms depending on the type of the disease. For example, those with inherited type 1 and 2A, B, and M are often asymptomatic or have mild mucocutaneous bleeding, like easy bruising, gum, and nosebleeds, and heavy menses sometimes. However, symptoms can become severe, especially in people taking anticoagulants or platelet anti-aggregant medications such as aspirin and other non-steroidal anti-inflammatory drugs or NSAIDs like celecoxib. Severe cases of bleeding typically present in people with type 3 and sometimes in people with type 2N. These people present with joint and muscle bleeding and gastrointestinal bleeding, but this one is rare. People with acquired von Willebrand disease typically present with new onset of bleeding on the background of some pathologic conditions, such as some autoimmune disorders or on anticoagulants or platelet anti-aggregant medications. Diagnosis of von Willebrand disease starts with general tests like a platelet count, which is usually normal except in von Willebrand disease type 2b, where it may be lower than normal. Other common tests include prothrombin time, or PT, and activated partial thromboplastin time, or just APTT. APTT is increased in affected people because it tests the intrinsic pathway, which includes factor VIII, which is reduced in von Willebrand disease. PT is usually normal, though, because it includes the extrinsic pathway that includes factors that work independently of von Willebrand factor. The next step involves assessing von Willebrand factor antigen, which measures the amount of von Willebrand factor present in the blood. It is followed by the measurement of its activity, which is done using ristocetin cofactor assays. When ristocetin is added to a plasma that contains normal working von Willebrand factor, ristocetin activates von Willebrand factor to bind to platelets, which adheres platelets together, resulting in visible coagulation. Okay, people with von Willebrand disease type 1 and type 2 that have bleeding episodes are treated with a vasopressin analog like DDAVP. DDAVP stimulates the endothelial cells and megakaryocytes to release von Willebrand factor. For people with von Willebrand disease type 3, DDAVP doesn't help because there's a complete deficiency of von Willebrand factor. So they are given intravenous von Willebrand factor concentrate, usually in combination with factor VIII. In some cases, when it is difficult to control bleeding, antifibrinolytic drugs such as tranexamic acid are used to help to delay dissolution of clots, thus sustaining clots for a little bit longer to prevent bleeding. All right, as a quick recap, in von Willebrand disease there is a quantitative or qualitative deficiency in von Willebrand factor, which increases the risk of bleeding. Most cases of von Willebrand disease are inherited, even though people can acquire it later in life. Inherited von Willebrand disease is classified into three main types, which are type 1, type 2, and type 3. The type 1 and type 2 present with minor to moderate symptoms that include mucocutaneous and nosebleeding, and sometimes heavy menstrual periods. People with type 3 present with severe forms of bleeding that include bleeding in joints and muscles, rarely bleeding in the gut. The diagnosis of von Willebrand disease involves testing for von Willebrand factor antigen and ristocetin to test its activity. For treatment, people who present with minor bleeding are treated with desmopressin analogs, while those with severe bleeding receive exogenous von Willebrand factor and factor VIII concentrates.